The most popular prescription painkiller in the country is about to get harder. The Drug Enforcement Administration is getting tough on hydrocodone.
As of October 6th, it will be classified Schedule 2. That's the same as drugs like morphine and methadone. That means more trips to the doctor for refills and likely higher medical costs for patients.
And News 13's Frank Crocker is streaming live for us in Asheville with our top story. Why is this happening now, Frank?
Well, it's actually a move 10 years in the making, a response to an epidemic. Now, overdose deaths linked to painkillers have tripled between 1999 and 2010, and experts say that hydrocodone is a major contributor. It's always a busy day at B&B Pharmacy in West Asheville. The rush to fill prescriptions, many called in or emailed by doctors' offices. But come October 6th, these pharmacists will be dealing with much more old-school paperwork signed by physicians.
It'll mean more people will be in the store, I'm sure, and waiting on prescriptions where before these could have been handled by phone.
Doctors wrote 125 million prescriptions for hydrocodone-based painkillers in 2012, making them the most prescribed drugs in America. Vicodin, Lortab, and generic versions are used to treat everything from back pain to arthritis to toothache. But their misuse for recreational purposes is well documented, and so is the fatal fallout. So the DEA is switching them to Schedule 2 to tighten controls. The feds believe doctors seeing patients personally will help, but there will almost certainly be additional costs.
That will mean a visit to the office, getting a new handwritten prescription for it, and then having it available for us.
And with the new restriction just 6 weeks away, there's the issue of prescriptions already written.
The current understanding we have is that on October 6th, any refills that are remaining will be invalid.
That'll mean rewrites and even more hectic days at pharmacies like B&B. But the folks behind the counter agree it's safety at stake.
There's a real abuse potential. We hear about it, read about it all the time, and I think the more that we do to control some of these pain medications, the better it's going to be for everybody.
There is another concern for pharmacies when it comes to their own safety, and we'll be talking about that on the news at 11. Reporting live in Asheville, Frank Crocker, News 13.